Hello, everyone. Welcome again. So this is our last slide from our previous video. And now I hope you got time to review the previous pages and previous video. And now let's move on to the next step. So in this lecture, we talk about larynx and trachea. So the larynx, as we said from the previous lecture, like it is partly in the upper respiratory tract and it is partly in the lower respiratory tract. So larynx is made of 9 cartilages. It extends from like cervical 4 to cervical 6 vertebrae. And the upper boundary is hyoid bone and it's changed into trachea. So the total length of the larynx might be around, let's say 5 centimeter, like 2 inches. And the function of the larynx is, number one, vocalization. So we have a few specialized structure in the larynx to produce voice. And it also provides the airway because it will lead into the trachea. And it is the site where the food or air, where they are going to the right direction, such as esophagus or the trachea. So larynx is an important part. So this is our larynx. As we say, like the top upper end of the larynx, we have hyoid bone, and finally it will change into trachea. The total length is about 5 centimeter, 2 inches, and it is made of cartilage rings. So okay, this is our hyoid bone here, like hyoid bone, and underneath the hyoid bone, it becomes the cartilage rings, which forms the larynx. And in this diagram, we can see a few important cartilages, like they are, number one, thyroid cartilage. If we look at this thyroid cartilage, that is the most prominent cartilage in front of our neck, especially if we extend the neck. And that is also called Adam's apple and laryngeal prominence. You can see that here, Adam's apple, which is formed by the 2 plates of cartilage from the right and from the left fused in the midline. That is what we call Adam's apple. Another cartilage which is important is cricoid cartilage. So cricoid cartilage is below the thyroid cartilage. So cricoid cartilage, so the space, we can see a space in between the thyroid and cricoid cartilage. That area is filled with the membrane and soft tissue. There is no cartilage, no bone. That membrane is called cricothyroid membrane. And the space between the thyroid cartilage and the hyoid bone, it is filled with the thyrohyoid membrane. So another cartilage, which we can see from this diagram for the larynx, is epiglottis. So here, epiglottis, it is made of elastic cartilage. Its job is to open and close the larynx depending on which cycle we are in, like whether we are taking a deep breath in or swallowing food. So that is the job of the epiglottis. So after the cricothyroid cartilage, it will change into trachea. Then trachea again, like made of cartilage rings. So if you look at these cartilage rings in the trachea and in the larynx, they are colored with blue, which is the hyaline cartilage. So epiglottis is the only cartilage which is made of elastic cartilage, but thyroid cartilage, cricoid cartilage, or the trachea ring cartilages, they are made of hyaline cartilages. So like we said, larynx is made of 9 cartilages. So they are arytenoid cartilage, which is paired structure, which slides on the posterior and lateral aspect of the larynx. corniculate cartilage, again, which is pair, and cuneiform cartilage. So these are pair, which will make a total of 6 cartilages. On top of that, what we have seen, thyroid cartilage, cricoid cartilage, and epiglottis. That will make 9 cartilages, which builds the larynx. The function of the larynx is open the airway, to close the airway, switching mechanism, and it is for the protection of the voice. So during swallowing, when we are swallowing food, the entire larynx will be pulled upwards superiorly, and the epiglottis tip will come down inferiorly so that the larynx is blocked and the food will be directed into the esophagus. So now, if we look at the sagittal view first, here and don't forget, this is posterior and this is anterior. And you can see the thyroid cartilage here. And you can see the epiglottis, which is the elastic cartilage here. And we can start seeing the trachea cartilages here. So just try to orientate ourselves again, like this is anterior and this is posterior, and this is the sagittal section of the larynx, and anteriorly we have thyroid cartilage and Adam's apple here, and we have below the thyroid cartilage we have the cricoid cartilage here, and epiglottis is somewhere here. And those cartilages we talk about, cuneiform cartilage, corniculate cartilage, and arytenoid cartilage, they all lines on the posterior and lateral aspect of the larynx. And here, this line here, as you can see here, which is identified as vestibular fold or fourth vocal cord. So now, anything, the portion of the larynx above the vocal cord or fourth vocal cord, it is in the upper respiratory tract, and the portion of the larynx below the vocal cord, it is in the lower respiratory tract. So now let's have a look at this structure again. Like this is the anterior part, because we have the hyoid bone here, which is anterior, and let's say this is in the posterior. So we are looking, this is right side, this is left side, and here we can see glottis. Glottis is the aperture, is an opening of the larynx, which is going into the trachea. And on either side of the glottis, we can see the arytenoid and corniculate cartilages. So now this is more like a simplified diagram. As you can see, glottis, which has got an opening here in the center, when it is open, and it can be closed as well because of the opening and closing, switching on and off, make the voice. And at the same time, like you can see thyroid cartilage, which is in the front, and you can see corniculate cartilage or arytenoid cartilage, which are in the posterior and lateral aspect of the larynx. So now this is more of a laryngoscope, which is showing the glottis region, which marks the division of upper and lower portion of lower respiratory tract portion of the larynx. And now here you can see like this opening is called glottis. And when it is switched off, you can see the vocal cord, vocal fold, true vocal cord, which is here. And those lateral to the true vocal cords, they are fourth vocal cord. So on the sagittal view, they are all at the same levels. And you can see the cuneiform cartilage and corniculate cartilage here. So now, after the larynx, like epiglottis, thyroid cartilage, cricoid cartilage, and then now our trachea rings start. So trachea is again made of multiple compilation of cartilage rings. These cartilage rings are hyaline cartilage. So it is these hyaline cartilages, they are not a complete circular cartilage. They are just like C-shape. So it is, the cartilage is present anteriorly and laterally, but not posteriorly. There are about 16 to 20 cartilage rings. They are all joined by the fibrous, elastic, connective tissue to each other. And as we say, it is just a C shape with the opening of the C posteriorly, and posterior aspect to the trachea, we have esophagus. So that, to complete the C, opening portion of the C, we complete with the muscle, smooth muscle, which name is called trachealis. It is on the posterior surface, which opposes the esophagus. So hey, let's look at that. This is a C-shaped hyaline cartilage rings, which is present anteriorly and laterally, but posteriorly, there is a muscle to complete the C to become O, and this muscle is called trachealis, and it is just in front of the esophagus, which is our swallowing tube. And therefore, when we swallow food, the esophagus can expand into the trachea. And don't forget, this is the surface, this is the inner luminal portion of the trachea. And if we do the histology slide, we can see the epithelial portion here, which is made of pseudostratified ciliated columnar epithelium. And of course, this epithelium need to lie on the connective tissue, which we call lamina propria. And then we have the submucosa. After mucosa, there will be submucosa. Here in the submucosa, we have seromucous gland, which produce mucus secretions. And finally comes the cartilage, which is the hyaline cartilage. So these are the layers of the cartilage. And finally, we will have the adventitia outside the adventitia layer outside the cartilage. So how many layers do we have for the trachea? I will say 3. Number 1, mucosa. Number 2, submucosa. And number 3, and number 1, mucosa and submucosa. Number 2, hyaline cartilage. And number 3, adventitia. So there are 3 layers. So if we look at this with a scanning microscope, these are the cilia we see on the surface of the pseudostratified columnar epithelium. So I want you to remember this diagram. I got it from Wikipedia, which I think is really nice structure. And we are looking at the sagittal section. So this is anterior and this is posterior. This is superior and this is inferior. So this is the larynx upper portion. And now starting from structure which is marked as 4, start the trachea ring. So trachea ring 1, 2, 3, 4, 5. And this is the number 2 is marked as the thyroid cartilage, and number 3, cricoid cartilage. And after cricoid cartilage, we start our trachea. So this is the laryngeal portion. And number 1 is our vocal fold, yeah, where we see the true vocal cord, false vocal cord, and that's area. And when we put a tracheostomy tube, you are going to see this tracheostomy tube again and again when you start your clinical rotation. And tracheostomy tube is making a puncture wound in between the trachea cartilages, and you insert the tube into the trachea. So that is for the tracheostomy tube. So now finally this trachea, which is made of partially cartilage rings plus partially smooth muscles posteriorly, about 16 to 20 critical rings, and finally comes down here into the thorax, and it divides into right and left main bronchus. So trachea we divide into right main bronchus and left main bronchus. The the point where the division of the trachea is called carina, C-A-R-I-N-E. Now, trachea divides into right main bronchus, left main bronchus, and enters into the right larynx and the left larynx. So if you look at the cross-section of the trachea of the bronchus, now we can still see the pseudo-stratified epithelium. Pseudo-stratified, but it's no longer ciliated. And we have the lamina propria, and this cartilage rings gradually become fibrous and cartilage layer. And then finally, these cartilage will disappear once the main bronchi start to divide into smaller lower bronchi, segmented bronchi, tertiary bronchi, or finally become bronchioles. So this is the entrance of the bronchus, main bronchus here, into the lungs. And I want you to remember the arrangement, the vein, pulmonary artery, which is carrying venous blood, is at the top, and the pulmonary vein, which is carrying the oxygenated blood, is at the bottom, and the main bronchus is somewhere in between. So this side of the lung is called high lung. We have seen that in our lab section. So now the trachea has split into right-hand main bronchus, and the splitting side is called carina, and the bronchus we enter into the right larynx and the left larynx. And now if you look at the right larynx, we have 3 lobes here: right superior lobe, right middle lobe, and right inferior lobe. On the left side, we only have left superior lobe and left inferior lobe here. And we can also see the cardiac notch for the heart. And that's the way we can differentiate right larynx and the left larynx. Don't forget the thymus gland, which is just in between 2 larynx, just posterior to the upper part in the superior mediastinum. And again, like the fissures, which divides the right larynx into 3 lobes, we will have horizontal fissure and the oblique fissure here. So 2 fissures divide the main right larynx into 3 lobes: right superior lobe, right middle lobe, and right inferior lobe. The same thing, we only have 2 lobes in the left larynx, and therefore we only need 1 fissure, which is the oblique fissure. So we do not have horizontal fissure in the left larynx. So now this is the axial section. Now our main bronchus here, which should be somewhere around here, and main trachea, which is around here, is divided into right main bronchus and left main bronchus. And finally, this bronchus will gradually divide into multiple bronchi and finally become very small bronchioles. And you can see the pulmonary artery, pulmonary trunk here, which is divided into right pulmonary artery and left pulmonary artery. And you can see the aorta here are coming out from the heart and the superior vena cava. I'm going to stop here, and I want you to go back again and study